One of the most common running related injuries is IT band pain. And it seems like most people don't really know what to do about it other than foam rolling directly on the IT band. I'm gonna share with you why that is not a good idea and the other main causes of what contributes to IT band pain. So IT band, again, is the iliotibial band. It's a band of connective tissue, fascia, that comes all the way down and then inserts into the lower part of the leg. A lot of people get that pain right on the outside of the knee here or coming slightly up the quad. But most commonly it's on the outside of the leg here. So a lot of people think that it's knee pain, but really it's because of the tight IT band. And so why do you have a tight IT band? I'm gonna talk about the main causes, what you can do about it, and things that you can implement during your run, before your run, and after your run to overcome IT band pain. All right, Dr. Jordan, what causes IT band pain? The main contributing factors to IT band pain is some type of underlying weakness, dysfunction of the bones or joints, or also poor biomechanics as you are running. So what this commonly looks like is if you have really tight outer quads, this will pull on the lateral fibers that connect to the IT band. So these tight quads will pull onto that and then not allow for the proper elasticity and movement of the IT band as you are going through your running motion. Another main cause is from valgus knee collapse. So if your knee is collapsing inward, it causes a constant stress and pulling on the IT band. So the main thing that contributes to that is because you don't have stable hips, stable, strong, supportive hips as you are running, or you have some type of dysfunction in your foot. So either the hip or the foot, if there's something going on wrong with those joints or an underlying weakness, your knee is gonna compensate and collapse inward over time repetitively as you're running, and that stresses it. So running is not like walking. Running is a 1 foot at a time activity. And so as you're on 1 foot, you need to have the pelvic stability so that you stay stable and your hip doesn't dip down and cause a pulling of the IT band. So we're gonna talk about proper ways that you can strengthen your hips as well as increase mobility of your hips and your foot. But first, let's take a really close idea of what the IT band looks like and where people are experiencing some of this pain. I thought of no better way to get a visualization of what the IT band is so you can help yourself prevent IT band pain. So the IT band is this tight, white, band-like fiber along the whole outside. It's actually a tendon, which starts from the glute med, it turns into the tensor fascia lata, the TFL, turns into that tight IT band, goes all the way down and then inserts into the outside portion of your lower leg bone. So a lot of people think that they could just roll right on top of that IT band to loosen it up. That doesn't work. Why? Because the IT band is a tendon. You can't really break up and lengthen the tendon. And also the main contributing factor of why people feel IT band pain is because the tight IT band is compressing pain-sensitive fat pads underneath the IT band here. So if you put a foam roller directly on the IT band and then you're rolling it, what are you doing? You're compressing those fat pads even more, causing more and more pain. So what do? So instead, what you have to do is break up the tight muscles around the IT band on the front side, the back side, and then right above it to help break up the tight IT band, since you can't break up just the band itself because it's a tendon. So you can use a foam roller to do just that. So what we're gonna be doing is instead of on the IT band, you're gonna shift your body weight to be slightly in front of the IT band here. So a lot of times people think, oh, I'm just gonna roll directly on that way. That's not what I want you to do. Instead, shift your body weight so you're at a 45-degree angle. So you're not directly on the quad, but you're in between the quad and that IT band, and then you can start to foam roll up. Find a position that's really tight and tender. So for me, I notice it's tighter, closer to my knee here. In that position, I can do what I call a pin and stretch. So now holding that, applying pressure, I can lengthen that tendon and the muscle groups by starting to flex my knee back and forth like this. And that lengthens it and breaks up those tight muscles. I can then go up to a higher portion, bend and stretch to start to break up those tight muscles. And then I can go all the way up to the glute med and TFL up top, which in order to do that, I'm gonna turn away from you, go up sideways, and then above my actual hip bone here is where that glute med is, which then can pull into the tight IT band. So getting that, you can also pin and stretch by raising the leg up and down. And then you can also do the same thing where you're rolling the back side of the hamstrings, but do not roll on top of the IT band. Make sure you're always in front of it, above or behind. All right, so now that you have a really good idea of what the IT band looks like, and you know now how to properly foam roll the IT band so that you're not contributing to more pain and inflammation over time, I want to share with you how you can start to train good mechanics as well as a simple stretch and strengthening to help prevent IT band pain over time. So the first thing I want you to notice is as you go through a simple squat. So squat is a great way to test your range of motion of your hips, of your knees, and your ankles. As you squat down, can you do that motion smoothly? Where in your body do you start to feel tension or tightness or a lack of mobility? It could be in your ankle, it could be your knee, it could be your hip, it could be your back. Those are all areas that you want to start to increase function so you can be a healthier, stronger runner. But also, I want you to pay attention to that collapse of the knee like we talked about. So if you're squatting down and you notice one knee start to collapse in, you probably have a severe weakness of the glute med stabilizers on that side, and then your knee is going to be doing that repetitively as you're running 80 to 90 steps per minute per foot when you're out on the trails. So instead, as you squat down, your knees should track out over the 4th to 5th toes, squeeze your glutes, come back up. So just something as simple as proper squats with knee stability is a great way to start to train good mechanics. The next one is a single leg deadlift. So keeping one foot on the ground, you're gonna do a hip hinge and also reaching forward. So your hip is gonna start to go backwards. And so you're keeping really nice leg stability. There's a tiny bit of a bend in my leg, and then slowly going all the way down to the ground. This requires the use of the entire posterior chain, so the whole backside of your body, the hamstrings and the glutes and the calves. And I'm also needing to create single leg stability so my knee's not collapsing inward as I go all the way down here to the ground. A big thing I want you to start to notice is, do you have the range of motion of your hips? So as you start to go down, does your leg start to flare out like this? If so, it's because you have a lack of range of motion and stability of that leg. Instead, I want you to keep your hips down and stable as you go all the way down to the ground. This will help making sure that you're lengthening this entire outside portion of your leg here. So you can do proper squats and then a single leg deadlift to train good function. Now we want to get into a simple stretch. So this is what I do before every run, after every run, is a simple crossover stretch. So putting one leg over the other and then leaning towards the opposite side. I'll start to feel that stretch on the outside portion of my leg. So the glute med into the TFL, all the way down to that IT band. I can and creating that stretch all along that whole outside. I can switch sides just to even my body out. Again, cross over, hips go back, arm comes up, breathe, and stretch. Really, really good stretch for just getting the whole outside of the arms, of the legs here, and also integrate that then into your upper body and your arms. The next piece is starting to get into strengthening now. So in this standing position, one of my favorite things to do is the woodpecker. So being able to go into this extended lunge position, I'm up on that back toe. I'm gonna put all of my weight onto my front heel here while sending my butt backwards. So this lengthens the whole backside of my body, and I lengthen my spine. I keep my spine nice and straight. I breathe into my body, creating space, turning on my low back and my abs. In this position, I feel this all in my hamstrings and my glutes, but now I want to get the outside rotators involved as well. So in this position, reaching forward as I send my hips back, and then start to rotate over that front foot, coming back up. Rotate over that front foot, come back up. And then as you do this repetitively with good stability and strength, you're starting to strengthen the outside hip stabilizers to work with your glutes and work with your hamstrings. Other things that people could do, which are super easy, is just a simple hip dip. So if one of the main causes is your hip is dipping, let's start to strengthen those stabilizers. So in this position with your knees bent, start to let one leg go down, squeeze, come back up. Squeeze, come back up. It might not feel like anything at first, but if you do this 10, 30, 40 times, you'll start to feel it really on that leg that is staying stabilized on the ground. So my hips go down, come back up. This will be similar to strengthening the muscles that you're doing with things like clamshells or a side plank. So clamshells, popularized by Jane Fonda, was in this side position with your knees slightly bent, just starting to open and close the legs here. You can do this without any sort of resistance, or you could put a band around your knees and start to apply that pressure resistance against the band so you have some resistance to make this stronger. In this position, you could also then go into a side plank to get the main trunk stability. So your serratus anterior, the outside of your abs, to work with your core, to work with your glutes, to work with your hip stabilizers, and hold this for 30 seconds to a minute to 2 minutes. If you want to challenge yourself even further, you can start to raise one leg up. And so now I'm working both sides of my core in the hip stabilizers. So those are the simple things you can start to do to train good function, to also stretch the IT band area and the glute med and TFL, and then also to start to strengthen and stabilize your body as well. So those are all super helpful tips that you can start to implement right away to help decrease your likelihood of getting IT band, or if you already have IT band pain, to start to overcome that so you can run healthier, longer, and stronger. I hope you found this helpful. We went super in depth of some of the main contributors to IT band pain. I also showed you what you can start to do right away. And I'm also open ears for any feedback or questions that you have for how I can continue to help you be a better runner. Please leave a comment below, subscribe to this page, and I'll see you out on the trails. Wait, before you go, I want to say thank you again for watching this video, and I also want to invite you to the Vital Stride Community Facebook group where runners like you are asking running related questions, and I'm helping people overcome repetitive running injuries. I look forward to seeing you in the group.